I guess everybody heard me and took it off because I didn't find the mute thing yet. All right, but we're good. Oh, come on. Thank you. All right, let me see if I can make this bigger for y'all. Okay, so when we're talking about behavior, okay, so Roy's looking at the person's behavior as their action or their reaction to whatever that stimulus is. And if you go down in the middle, you see three things there, right? You see focal, you see contextual, and you see residual. So we're going to talk.
I only see, you're on the Word document at the beginning of the top of the page. I don't know if I see your screen or not.
You see Roy Care Plan?
No.
No, it's
No.
still the Edith Jacobs.
Okay, let me do a new share, sorry. See it now?
Yes.
Okay, so I emailed this to you guys also, okay? This just tells you about what you're looking at, okay? So you have your focal, you have your residual, you have your contextual. That's going to be in the middle part of your care plan. Now, if you look at your care plan and you scroll all the way down to the bottom where the actual nursing care plan is, you'll also see a column there that says focal, contextual, residual stimuli. You guys see that? You have your care plan.
Yeah, I see it. I have it up. Yeah, it's like the almost last page.
So whatever you put in that middle section, you're going to copy and paste right to there because it's going to be the same information. Okay. So your stimulus, your focal stimulus is what the patient is kind of focused on right now. What's going on with them right now. Okay. So for this patient, it could be a couple things. All right. She's got a change in the environment. Okay. So that may change the way she reacts. Focal stimuli could start out as one thing and end up being something else. So let's say at home, the patient was getting dizzy and falling. So there's a couple focal stimuli there. One is the dizziness, right? That's causing the fall. Two is the actual fall itself could be her focus, or she could also be focused on the fact that she's fearing losing her independence. Tell somebody she falls. So, this is what she's thinking about. Okay. So let's look at the case study down here. If you look at the case study, okay, you have a patient here that's here for cancer. Okay. She doesn't understand the processes of the cancer. Okay. So she's going to respond according to those things that are happening to her. So she's got cancer of the bladder or the uterus. So she was catheterized and now she can't empty her bladder. Okay. So now you have to look at what is her focal stimuli. So her focal stimuli is going to be the disease that's causing this urinary retention, because she might not understand the whole cancer and what it actually does. It could also be the urinary retention itself. So it could be either one. Okay. And then they had to catheterize her now in order to get urine out. Okay. So she already had tissue trauma, and that was from the surgical procedure that she had and the radiation therapy. So that's what we call contextual stimuli. So, her focus is on the disease process, and then contextual is anything that contributes to that disease process or that problem. Okay, so the radiation, the tissue trauma could contribute to that urinary retention. Residual is usually something that the patient has that also is changing their behavior or their reaction that they're not aware of. So like in this case, she has anxiety. So they're calling that her residual because it's affecting her ability to adapt, but she's not really aware that she's anxious about the situation. Now, for me, with the lady with the broken hip, right? For me, the focus in the beginning for her, again, was that dizziness and that risk for falling. Because if she knows that she falls and gets hurt, and this is what a lot of elderly do, they fall at home and they get hurt and they don't tell anybody because they don't want the person to say, oh, well, now you're falling, you can't live by yourself anymore. So her focus could be on her independence. Okay. It could also be on the pain that she's having from the broken hip. So there's really no right or wrong answer there. It's what do you feel is causing the patient a change in the way they're adapting to their environment at the moment. Does that make sense? Or are you guys confused? Do you understand what the focus is? Or the focal point? Speak up if you're not sure, because I want you to understand.
So are you saying that the focal point is the same as the conceptual?
So the focal point is really anything that is immediately confronting that person. So remember I said it's her safety, her dizziness, the fall, the pain.
Is it basically like what she's saying? That's the focus, like what she's saying?
What's happening, what's going on with her right at this moment.
Yeah.
Okay, it could even be the surgery because she's facing surgery tomorrow, right? So she has to now be MPO tonight for that surgical procedure tomorrow.
Mhm.
So okay, so the focal point is what is going on with them right now?
Let me
Conceptual is
pull this
anything.
other screen up for you so you can see it.
Mhm.
And I actually sent you guys this link for this, okay? So see here, assessment of the stimuli.
Right. Now, my question is,
You're now identifying internal and external stimuli that are influencing that person's behavior.
okay,
Focus
are we,
stimuli would be the most immediate issue that person is facing at the moment.
okay, are we allowed to use medical diagnosis?
For this part, you can, but you won't
Okay,
get the medical diagnosis in your actual nursing.
no, right.
Okay?
So let's
you
just,
could use the hip fracture.
okay, got it.
Okay, then contextual would be any stimulus that's there that is affecting the situation. So what's affecting that situation at the moment? So let's say that I picked dizziness as my focal point for her. Okay, things contextually that may have affected that are her medications that she's taking for the osteoporosis, her sedentary lifestyle.
Like contributing factors.
So can it be the contributing factor?
Yeah,
Yes,
contribute.
similar to
Okay.
that, but it's usually contributing factors that you're kind of aware of.
Mm-hmm.
Whereas residual is that affects the process also, but the person isn't really aware that it's affecting it. So like we just talked about the lady with the anxiety, right? For this woman, it could be fear of loss of independence, right? It also could be things that could affect her or her genetics, because the genetics may have led to the osteoporosis. The menopause may have led to the osteoporosis. That could be contextual, or it could be residual, because she may not be aware of that. She may not be knowledgeable of that's part of the issue. She may not be aware that the sedentary lifestyle and the menopause and those kind of things, and also her race, her ethnicity could affect that bone structure also, right? Because
Can you give an example for for residual for that patient again with the dizziness?
So an example for residual would be something like ethnicity, It could be the fact that her culture. So let's say I had heart disease, okay? And my culture is to eat fried fatty foods, okay? I like to eat a lot of foods that have a lot of like sodium and stuff that increases my blood pressure and is not good for me, right? But I have heart disease. Now, what is my wife gonna cook me? Come on, guys, what's my wife?
She's gonna cook you something that's not salty, like,
No, she's not.
She's gonna cook you the same
Something
food.
not salty,
same
what
Gonna
am
cook
I
you the
gonna
fried
do?
salty foods.
She gonna make me what I want, right?
Right. Yeah.
Because if she doesn't, what am I gonna be to her? Mean, cranky,
Make her feel guilty.
yes. And in order for her to give me healthy foods, who else is gonna have to eat healthy foods?
Her.
Her, yeah.
Everybody, right? Everybody, because am I gonna be up here frying chicken for my kids and giving you a salad? I don't think so.
Right.
Fry that chicken around me, I'm getting the chicken. Dog salad. Now, what happens when the patient goes in the hospital?
Everybody's going at the house is gonna eat fried chicken.
it's like
Correct.
the
The patient at the hospital is gonna get what?
somebody's not
That,
aware.
the correct meal that
Correct,
they
yeah.
need.
So that low salt cardiac diet, right?
Right.
Gas diet,
Right.
okay? But what he's gonna try to do is put the guilt trip now, right? His behavior is gonna change now. He's gonna put the guilt trip on people coming to see him, right? The kids, the wife. Oh, he gonna put it on him. You're not feeding me, I'm hungry. Nobody cares if I eat here. How many times you see people sneaking food in the hospital? Yeah, it happens all the time, right? Because, and so that's like residual. It's my culture. It's things about me. Just like if I was, let's say I was Muslim and, you know, I'm supposed to be fasting for Ramadan and I'm in the hospital. You're going to have to change my diet for me. You're going to have to change things around because I'm not going to want to eat. And that's going to stress me out if you try to force me to eat. The stress can be worse for me than not eating.
Are you gonna use that bag?
So you see how the environment can change the way the person interacts with it. And so these stimuluses can produce those different changes. So like in the elderly, one of those things is loss of independence. When they fear that they're going to lose their independence, they may not report certain things that happen. And, you know, you'll come in and find them on the floor and they've been laying there for 10 hours with a broken hip because they didn't want to push the button or call somebody because they didn't want somebody to know they fell. In their mind, they're saying, I'll eventually be able to get up and I don't have to tell nobody. Some of them will lay there and end up dying if the family doesn't come in and check on them. All right, so think about that focal point. What is it for this patient? Is it that fractured hip? Is it the pain? Is it the fear of falling? The fear of losing that independence? What is it? And then what conceptually, okay, what other stimuli are present that affect that current situation?
Miss, can you give an example of the contextual?
So if, let's say that my, focal point here was, the dizziness. Okay, what would contribute to that dizziness?
You said like the medication, it could be a side effect from the medication, right?
Okay, what else? If I don't eat and drink enough fluids, right?
Yeah, correct.
Dehydration.
Yeah.
And like being
Times
lazy,
with
not moving
older
around.
People, with older people, their vessels are not as flexible as they are when you're young. So a lot of times they'll have that orthostatic hypotension when they stand up, they get up quick, they don't even realize it's happening, and before you know it, they've already fallen. Because they have that little syncopal episode. So all those could be contextual. What else? The osteoporosis itself could really be contextual. Because the softening or the way it affects the bones, okay? Now, I gave you a little breakdown on another sheet for steps for the nursing process, okay, for when you're doing your diagnosis. Where'd it go? All right, so make sure you get your template out. You're going to collect your information, and most of it's right there in that case study for you. Okay, the only labs you have to put on there is if it's abnormal. All right, and as far as the x-ray, the only thing you have is the abnormal x-ray. That's the only diagnostic test you have that's abnormal, okay? It showed a fractured left trochanter or something like that. So you want to put that on there also. Underneath where it says, underneath the labs where it says teach. So under there, you want to put whatever like referrals that this patient's going to need when she leaves the hospital. So she's going to need like a home health care nurse to come out and assess for what?
Environment.
Safety, right?
Safety.
Because you want to make sure she doesn't use her walker and her cane. You see that in your case study, right? So she's going to need education about fall and fall risks. I think she's got some issues with eating. So you'll probably see that when you go through the scenario itself. But is there any issue there, you know, with her weight, with her eating, nutritionally that might, you know, interfere with her ability to heal or get better? Look at all that. Because that can help you come up with your nursing diagnoses. It can also help you come up with your subjective and objective information. You have to have something in all those boxes, okay? So subjective, you've got information in there for that, and you've also got stuff you can see. It can't be objective unless you can see it or measure it. And the only one that you can measure that's not objective is pain. All right, pain's subjective. When I say you can measure it, because you can give it a rating of like how many out of 10, but it still is classified as subjective. All right, so then you're going to analyze. You're going to look at all the information. Okay, where does the patient have trouble? You know, what do you need to help them improve? And all this stuff should go together. So let's say your diagnosis is impaired mobility. Okay. It's not a risk 4 because she's actually impaired. Okay. So risk 4 is only if they don't have the issue yet. And risk 4 is what you apply to someone that if, let's say, I'm sick and I have diabetes and you're sick and you're healthy. Okay, I'm a risk for infection because I have a disease that breaks my immunity down and affects the way I heal. So if we were put in the same situation, if I slice the bottom of my foot and you slice the bottom of your foot, I really would be more of a risk for infection than you would be if you're healthy. So that's where you have the risk 4 diagnosis. But the risk 4 is only when the person doesn't actually have the condition. So if someone has an infection, you don't use risk for infection, it would be something else. All right, so she wouldn't be a risk for impaired mobility. She is impaired mobility. And then what's it related to? What's causing this immobility? So she's got alteration in tissue perfusion. She's got to that left trochanter. She's got the dizziness, right? Which makes her, she has an inability to transfer herself. She's not able to transfer herself independently. Now, that could also be your as evidenced by. Because what you could say is she has weakness in the muscles and the legs, okay? She's got dizziness. So that's what the impaired mobility is related to. And then it's as evidenced by inability to transfer self independently. So you see, you can interchange those a little bit there. And then I gave you a site also on here, a link I think that you can go to get some of your NANDA nursing diagnoses. Think about, you know, how you discovered these issues. How do you know the patient's in pain? That's going to tell you what your objective, subjective information is, okay? So if the patient told you something, that's subjective. But if you were able to gather the information by looking at it and seeing it or reading about it through a diagnostic study or something, then it's objective. And it should be written in layman's terms. You can't use medical terminology in your nursing diagnosis. So you can't put fractured hip. All right, that's not a nursing diagnosis. You could put impaired mobility. And then here, if you go here, this will take you to where it breaks down the nursing diagnosis a little bit more for you so that you can kind of understand it. All right, so in here, it'll kind of show you exactly what the components are and how to write the statement. Can you guys see that? Yes, no, maybe so?
Yes.
Yes,
Yes.
yes.
Okay, has anybody started this part of the nursing process?
Miss Sue, can you click on that?
Huh?
Can you go to those NANDA? Can you click on that link? Or is that just?
You should be able to click on it. Not these ones up here, but when you get down here, it'll give you examples. And then over here, you can click on these, but I'm gonna show you what to do once you decide. So let's say you decide that you want your nursing diagnosis to be impaired mobility, all right? So you're gonna just type it into the browser bar here.
We can't see anything. Like it's frozen or something. Screen.
Can you see my Google screen?
No.
Yeah.
Okay, now we see it.
Mm-hmm.
So in here, you're gonna type impaired mobility, okay? I want you to look for a site called nursinglabs.com. There it is right there. Impaired mobility nursing care plan, okay? This is the easiest way to do it. So when you scroll down here, okay, it's gonna tell you the signs and symptoms of impaired mobility. And the first one here is inability to transfer, right? That's what our patient has right now. So that you qualify for this. If you go on down further, okay, it'll tell you what your assessments would look like. And then down here, it gives you nursing interventions along with the rationale. You have to have 5 interventions, 5 rationales for 1 nursing diagnosis. So on the paper, you'll have 3 nursing diagnoses. Put your most important one on the top. And all your interventions, your rationales, your goals, your evaluation is all going to be towards that 1 nursing diagnosis. The other ones are just listed there. Okay? So if your patient is there for impaired mobility, you're going to pick 5 nursing interventions from here and just tweak them a little bit so that this is what we do. We take a standardized plan of care and we tweak it a little bit to meet the individual needs of the patient. Your goals are right there. Now, here's the other. You have to have a reference. If you have a reference, I will call it for that. Okay. Right here, you can just copy this. Copy it. You put it down at the bottom of your paper, underneath where it says interventions and rationales. Okay, so that way when I check your care plan, I can click on that link. It'll bring me right to this page. I don't want a generic link there. It shouldn't bring me to just nurses labs. It should bring me right to the care plan. So if you copy it while you're in the care plan, it'll do that for you. Copy it, paste it right into your paper and put references next to it. And here's more references here if you want them. So you actually could copy and paste this at the bottom of your page and it would be correct also. And if you want to know more information, I believe this will take you right to a link. Haven't tried it, but it might. Or it might take you to a book they're trying to sell you. Yeah, that's going to be what it's going to take you to. So get the free stuff, okay? All right, questions on now the goals, okay? When you write it, well, first, let's go back to those interventions for a second.
It's okay. Why didn't you remind me about the meeting?
All right. So let's say that one of my goals was to present a safe, and one of my interventions is to make sure that the patient remains safe in bed by having the bed rails up, the bed in a down position, okay? To promote a safe and secure environment to reduce the risk for falls. All right, so that's my intervention and my rationale. Now, what's a goal I give the patient that would be similar to that? So for one, I could say the patient will learn, the patient will verbalize an understanding of using the call bell when they need something prior to attempting to stand up or something, okay? And that they'll learn that by the end of the shift. So I could say patient will demonstrate how to use the call bell within 2 hours to prevent getting up and falling. That's a short-term goal, right? And it's something I would want them to learn because I wouldn't want them pushing that call bell and trying to get up. And it also goes with my intervention of impaired mobility. Or, I mean, my nursing diagnosis of impaired mobility, because I'm doing something because the patient can't move safely on their own to prevent them from falling or getting injured. What else is something that I could teach the patient to do?
Can you repeat yourself? For some odd reason, you're cutting off.
What else is something I could teach the patient how to do to help with this situation?
To keep the what's the rugs out the way, like those accent rugs.
Okay, so that could be a long goal for at home, right? Because they're in the hospital right now. But that could be a long-term goal at home is to,
The area rugs. Yeah, the area rugs, 'cause you can slip and fall on those.
okay,
That's when I phone said.
You want to make sure she has everything in reach before, you leave the room.
What about a use of a
Okay.
bedpan?
okay, so you might need a bedpan there or a commode.
Mhm.
Now, you have a patient with a hip fracture, okay? Their risk factor is impaired mobility. I mean, their actual nursing diagnosis is impaired mobility. They're immobile. They have this giant hip fracture. They're 85 years old. What do you think they're at risk for?
Skin integrity, skin problem,
Down.
Pressure also.
redness, pressure.
Blood clots
Infection.
and blood clots, okay?
Right.
Mhm. 'Cause the
So,
surgery.
yes, definitely the breakdown, okay, because they've got that thin skin. They don't have that subcute fat like, they used to have. Those skeletal muscles aren't working the way they used to. So definitely they're at risk for breakdown, right? So you could teach them ways to reposition. You can also do repositioning for them. Like in her current condition, she's going to need a couple people to reposition her right now because she's pre-surgical. She's got that broken hip, which means that one leg is going to be shorter and it's going to be externally rotated until they go into surgery. So she really can't move herself from side to side, and you can't even move her by yourself. You have to bring a second nurse in to move her. All right, so keep that in mind. Now, you could teach her how to do active range of motion with the leg that she's not using and with the arms and stuff to try to squats and stuff, right? And she might even like just wiggling the foot or the ankle on the leg that is broken just to keep a little bit of movement there. So that's an intervention or a goal you can consider. Whatever goal you make, she has to demonstrate something to you or show an understanding. Okay? And there has to be a time frame to it. And it can only be one goal. So you got to keep the goal simple because you're going to have to evaluate that at the end. So let's see if they have some goals down here. I don't see any. But I know what the goals would be for this patient would be similar to what these
They
rats,
was looking for you.
whatever you instate in the patient, you're going to want them to continue to do that when they go home. All right, so you're going to set goals. Once you set those goals, that last column in there that says evaluation, now I've set the goal. So let's say patient will do 10 ankle pumps with the foot at least 10 times a day. So that's one of my goals, right? And they'll do it by the end of the shift, let's say. Okay, it's a short-term goal. So you have to have 2 short-term and 1 long-term goal. Okay, so now when I go back and evaluate, my evaluation looks back at that goal and says, was the patient able to do those 10 foot pumps within the time frame that I gave them? And if they were, then they met that goal. So the patient has to agree to the goal. It has to be something that the patient's willing to do. Okay? And that they have value in and that they agree upon. Because otherwise, they're not going to do it. Long-term goals are usually written for when the patient leaves the hospital. So again, you're going to have 2 short-term, 1 long-term. And I'm going to see if I can bring a care plan up just to show you guys what one looks like. me stop my share here.
That's all right, girl.
Okay, let me know when you guys can see it.
Yeah, we can see it.
Okay, clinical site, you can put whatever, it doesn't matter. All right, and then the date. Up here, your patient's initial code, that's the first two initials of your patient's name. And I'm just going through this because I've talked a lot about it, so now I want you guys to see it so that you understand it. So it makes more sense. Okay, everybody can see it good? Okay,
Yep.
can't let me know.
Yeah.
All right, over here, we had to add the blood pressure column, okay, because it wasn't there. So you could just type it in there on the Word document, the blood pressure. The primary diagnosis, so for her, it's going to be that left hip fracture. And then PMH is going to be medical history. So whatever medical history you know or you have about her. And then you see the social history, white, female, Catholic. This lady's Christian. She lives alone. Pain assessment, okay? If it's 6 out of 10, you put 6 out of 10. If it's 2 out of 10, you put 2 out of 10. Admission date, whatever you put there is fine. You guys should have her height and weight, and you should have her allergy status. All right, now when they talk about behaviors, RAM, physiologically, okay, how does the body physically adapting to what's going on? All right, so over here you have O2 status. Now, if she's on oxygen, where it says L/M, you would put 2 liters per minute or 4 liters per minute, whatever she was on. Lung assessment, you're just gonna put, how does the lung look? What does it sound like? What's the respirations? And actually, you don't have to put the respirations there, just the lung sounds, because your respirations will be up here under vital signs, all right? And your cardio assessment. What's the skin look like? What's the temperature, the turgor? All right, if they give a Braden score, you can put it here. I don't know if they gave one for her. I don't think there was a Braden score in there. Does she have any wounds? If she does, and you have that information, you can put it there. Give me 1 second, guys.
Anyone open up their books today to study? There. Stop, Mary.
Hashtag no, I took a break.
Me
I went
too.
to a job that was freaking horrible. Oh my God.
Oh,
You
man.
went
My feet for
agency?
8 hours. Yes. Oh my
Oh,
God.
girl.
Yeah, I can't.
I go for what I know. I don't got the patience for nothing new right now.
I can't. I was
Yeah.
like, oh no, never again.
Yeah.
I didn't. I actually went out for a drink. I just came back at enough time to get on this.
My feet are like throbbing. I want to just.
Oh man.
I had a long day. I have to relax today. No
I
books
relax.
for me tonight.
I know, but I gotta
ain't
open them up
opening not
tomorrow though,
one
because
book,
the
not
finals is coming up before we know it, y'all.
Absolutely.
These weeks
We
is
got a
gonna be
quiz
flying by.
Tuesday.
So
And
are
then-
we really having the test on Tuesday?
Yeah, but why did she say? Did you
Quiz.
get the
It
email?
don't make
said
sense to me.
On 1
for
through
real.
7.
Yeah, nutrition quiz 1 through
Yeah.
7, which
1
I
through
thought we should
7.
have had that. Yeah, we should have had
Right.
that before the midterm. It would have been a good
Exactly.
practice.
I
I
don't
feel
know
like we
what-
need just chapter 7 because we did 1, 2, 3, 4.
or like I
5
thought
and
it was
6.
8 and 9 or something.
I
8
think
and-
she's doing it just to
No.
boost our scores because it's something material we already know. So maybe
I could use it because I don't think I did good on the
Yeah.
midterm for nutrition.
Yeah.
Yeah, I'll take it.
Me too. She probably saw them test scores like I'm gonna just do 1 through 7.
And it's gonna be
I'm about to
virtual,
do
right?
a extra credit for English.
It probably should be virtual. Yeah, I would assume like the other ones.
What we got Monday? Any
English.
English.
Yeah,
Yeah,
the,
do we have
draft,
anything going on in English?
the outline.
We have to have our outline done for
Oh,
Wait,
So that's
what?
the week after.
oh no, it's not. I'm like, I could have swore it was the
Not this week, coming up at the next week. He said 2 weeks after the midterm.
you
I
sure?
just-
I got it
I'm
in my
sure.
book
I
as the
just
27th.
looked at his email. He sent me through Canvas. He said he got a whole timeline. 2 weeks after
Okay.
the midterm is when the outline is due.
Oh, good. Because I definitely put it in my book for the 27th.
Yeah, but I'm gonna probably work on it next week though, just to try to get it out the way, because their research paper is what's gonna get me.
Wait, so that means our rough draft is not due on the 4th then? Because I had our rough draft being due on the 4th.
I have to look at my calendar.
Yeah, I
don't-
gotta
I
look
got
at
it.
um,
Yeah, because I really wrote my stuff in my book. Unless I looked
Hold
at
on,
the
let
wrong
me see.
Let
day.
me get my.
Let me say.
Wait, and the analysis is coming up for nutrition.
I thought the rough draft was due. Hey, I thought the rough draft was due on Monday, or the next. It's not due at the next class.
I thought the outline was due first. I
Oh,
put
maybe it is.
research paper
Yes, the
outline.
outline, then a rough draft, then the final paper.
Right.
Oh, okay, okay.
The
So-
final paper
oh,
not
yeah,
due to
the-
the 18th.
Paper outline, yeah.
Yeah,
It's
the
due
outline
on-
is due.
It
it's
say
due on the
27th. It say the
See,
27th.
I
It's
knew
due
I
the
put it in my
27th.
book.
What?
It
Yeah.
says 20. That's 27.
Yep. If
Yeah,
you look
I
at
wrote
the
it down.
syllabus calendar, it
For
says
the,
the
for the
outline.
outline, not the rough draft.
Just the outline.
Yeah, just the outline,
outline,
just your
yeah.
outline.
Okay, I was just
But-
looking at it earlier when I was at work. I was just going through Canvas like real quick, and I just wasn't sure like if it was next week or the week after. I don't know
Yeah,
what I
that-
was looking at.
The draft not due to the 4th though, the following week. So
Yeah.
the draft is 2 and
Okay.
2 weeks.
Okay.
2 weeks.
Yeah, the outline is due on Monday.
On Monday.
Bro.
Oh,
But
Brett.
Monday, but he said 2 weeks. Child.
Nope. It says it there,
It
right
says
there
the
in the calendar.
27th. Yep.
Oh, my.
Yeah, but I know what she's saying because on that paper he sent us.
I know what you're talking about.
it
When he
said
he
2
sent it in the
weeks from
email,
the
it does
midterm.
say it.
Yeah. So I gotta confirm with her because if it's in 2 weeks or next week, because it's
Sorry,
confusing.
guys, that was my instructors calling to which they all got on a game phone call to call me from the school.
Oh, that was nice.
Yeah. What
Hello?
y'all was talking about, Miss Sue? Great.
Leaning on me.
How about now? Can you hear me now?
Yeah, we heard.
You probably heard me before, right?
Huh?
You probably could hear me before, but I couldn't hear you.
I said what y'all was talking about, the grades.
Oh, no, not the
You ain't
grades.
gonna tell us?
They were just calling to tell me, thank you, that they miss me and all that good stuff and get well and all that kind of stuff.
Oh,
Miss Sue, when are you coming back to work?
I don't know. That's what they were asking me, and I'm like, I don't know.
Miss Sue, thank you for the midterm.
I still have 30 staples in.
What happened? You broke your
Wow.
leg, right?
Huh?
You broke your leg?
Mhm.
Uh,
I broke my leg and I had to have 2 different types of surgery on it.
okay.
So that's the issue. I can't put any weight on it right now because it's in bad shape. So it happens. But I'm hoping that after I go for my appointment next week, that they might let me at least come back to work if the leg fills up to it. Right now, the leg don't want to be down. So that's the issue. It's very painful when it's down, and it doesn't take long for it to start feeling like that. It goes quick. So, okay, so back to this. So the diet, what's her diet? Does she have any supplements? Some of that stuff you might find in the actual module. But you can go mostly by what's in the case study, okay, and use most of the information from that. Over here where it says rest and activity, you want to put about a range of motion there. You want to put about her using the walker there, about her needing assistance with the transfers. And also there's a fall scale listed in there that we do on the elderly. So that's going to be listed in the case study. So you should put that score there because that tells about risk factors for her. And then her overall appearance, the mood and all that. As far as cranial nerves, you're not really going to do any cranial nerve assessment with her. So you can just put not applicable for that. And then for her senses, it'll talk a little bit about that in the case study. And mini mentals, I don't think we did a mini mental status score on her in the case study. There might be one there, but there is a Glasgow Coma Scale score for her. All right, under self-concept, there you're going to put her religion, the body image, okay, how does she see herself? The main 2 here, as long as you have religion there and you have Erickson's stage there. If you can't really figure out a body image concept for her, I'm okay with that. But I definitely want the religion and I want the Erickson stage for her. Full transition. So what's happening for her? Once she broke this hip now and she's not able to transfer independently, she's going to have some sort of assistance. So now she's going to end up going from an independent role to a dependent one. And then who's her support system? It could be her daughter, it could be the church. So for this patient, okay, the person who did this care plan, they picked the focal part for safety for this patient. All right, because the person is unsteady on their feet. So they're worried about, the person's safety. And also the patient here had a venous stasis wound that wasn't healing. And that was contributing also to some other things, but so either one of those could be the focal point, the safety or the venous stasis wound that the person's currently hospitalized from. Either one of those could have been the focal point. And then conceptual, so they put, not aware of safety hazards in the home, that's good. The patient's unsteady gait. This patient had swelling to their lower extremities. So that also probably contributed to their ability, because when your legs are swollen, it could affect your sensation and the way you ambulate. Now, I wasn't that keen on what this person put for the residual. I could go with the education about the wound care. I'm good with that one because that definitely could be residual. And I guess the forgetfulness is not too bad because that is a safety concern, right? If someone has dementia or whatever, they do things that are forgetful, like leaving the stove on, forgetting that they can't ambulate without that walker or that cane. They forget that they shouldn't have throw rugs down. They forget to leave lights on. So that could definitely be a residual component. Under medications, okay, you have to have some sort of nursing consideration there and whatever medication she's on. So usually nursing considerations are things that we would be concerned about for the patient and that we would teach them about. Again, for labs, diagnostic studies, you only have to put if it's abnormal. If it's normal, it doesn't have to go here. And then teaching and discharge, you're going to do your behavior that's related to anything that's related to what's going on with the patient. So like this person wrote for referrals for POT. Okay, the person has a wound, so physical therapy to help them, a diet or a nutritionist referral so that they can take in a proper diet to help with that wound healing. And then teaching about safety, teaching them about any new medications, any new treatments. And this person's also going to be taught repositioning skills so that they don't do further damage to the tissue or the skin. All right, now this is the actual nursing care plan, all right? A lot of people like to write nothing under subjective. There's something there, find it. I don't want to see nothing there. There's something there, right? The patient's moaning, they're groaning, they complained of pain. What else did they tell you? And then what did you physically see for observable? You have at least an x-ray. You have the leg being shorter, that's observable. It being externally rotated, that's observable. And then under this focal, contextual, and residual, remember, you're just going to copy and paste what's in those boxes above right here. All right, now the person's nursing diagnosis here, the very top one, if you see it, risk for injury, okay? This person has an actual unsteady gait, okay? So they're writing risk for injury related to the unsteady gait as evidenced by inability to transfer independently. So you don't have to have 3 components as a risk for, because sometimes with the risk for, okay, we don't always have all these components since it's a risk for. So another good one for this person was I felt like the best nursing diagnosis for this patient was the knowledge deficit related to wound care, okay? And that was evidenced by the patient not knowing how to monitor for the skin integrity or to complete the wound care using aseptic technique. So part of your intervention now for that would be to teach them how to use that aseptic technique for the wound care. You would want to refer them to a nutritionist or a dietitian, okay, because taking in proper nutrients would enhance the wound healing. You would want to teach the patient how to monitor the wound for redness, swelling, and drainage. You also would want to teach them how to prevent infection and how to prevent additional skin breakdown. You would monitor those white blood cells to prevent a possible infection, or in order to, do treatment if they did have an infection. All right, so now here's the goals, okay? So look at these goals carefully. All right, the client will be able to ambulate 100 feet with an assistive device twice a day with nursing staff by the end of the shift on 6/10/21. It's clear, it's specific, we can measure it. So remember that SMART acronym in your book? It's obtainable. These are all things that goal has to have, okay? And this nurse wrote, it looks like a couple of long-term goals and a couple of short-term goals. So patient will be able to demonstrate one repositional technique by the end of the shift on 6/10 to help prevent skin breakdown. So again, it's clear, it's specific, there's one goal there, and there's a time frame. Patient will be able to demonstrate and perform a treatment change to the venous ulcer by the time of discharge. And that's a good one. The only thing I might change about that is maybe add in there using aseptic technique, because you would want that to be included. Now, if you go over here to evaluation, okay, goal met, patient was able to ambulate with assistive device 100 feet, okay, with nursing staff by the end of the shift on 6/10. So you stated what the patient was able to do. That was the goal that you set for them, and they were able to meet that goal. So really here, you're just restating what you did and that the patient met it. The other one we read about the patient being able to demonstrate the repositional technique. So evaluated, the patient demonstrated a proper repositioning technique by the end of the shift on 6/10/21. So the goal was met. Now you could write goal not met, patient not able to ambulate 100 feet with assistive twice a day with nursing staff by the end of the shift. Now that meant the goal wasn't met. So at that case, you would either try to give the patient a little bit longer to meet the goal, or you would make a different goal for the patient. You don't have to do that in the care plan, but in real life, that's what you would do. That's how the care plan works. That's what we're trying to do here. So when we talk about, evaluating and then modifying the goals, that's what we're talking about here. All right, anybody have questions on that? And you see, she put her little link down here, right? For injury. So if that was the one I was using, I should be able to just click on that. I should be able to. Or I should be able to copy it and put it in my browser, and it should take me right to that website. It brings me right into that care plan. Can you guys see it? All right, so whenever you cut it from out of there, it'll bring you right back into that, all right? So anybody have questions on that?
No.
No, but I have a question regarding the fluid and electrolytes. It was, what is HL, CVP, or other?
So central venous pressure is CVP. Where do you see this at?
On the front page. It's below nutrition under fluid and electrolytes. It's with the IV gauge, IVs gauge and rate.
Okay, on the care plan information that I gave you for Miss Jacobson,
Yes.
it must be on the top somewhere, huh?
We can't see your screen, Miss.
Sorry.
It's still in the nurse lab.
It's the first page and it's the fluid and electrolyte section.
Can you see it now?
Yes.
It's on the RAM form.
Oh, it's on the RAM form?
Yes.
Okay, let me go back to that then. Okay, so there, all you have to put is the IV, whatever the IV is, and then the site, okay? And I think it lists that on the case study for you. It lists the IV gauge and it lists where it is and it lists the rate. That's all you have to put there.
All right, thank you.
Put the HL, the CVP, or other access. I don't even know what the HL is there. CVP is central venous pressure.
Okay, so I could just put NA for that stuff.
Yeah, you don't even have to put anything there. As long as you put in up here where it says IV gauge, you're gonna put whatever gauge IV she has in, if it says it there, and I think it does. What the rate is, okay? And then where's the site of that IV at?
Got you. Thank you.
Any other questions? Okay, let me open up the floor now for questions about the RAM paper. And then we'll do the VSIM. So anybody have questions about the RAM project that you're doing with each other? By the way, I still haven't gotten from the majority of you guys who's in the groups, who's the group leader.
So yes, Ms. Sue, so what do we have to do with the RAM paper? I'm sorry, in the group.
So remember, you have that little paper and each person has to write one portion of it. And then you put it all together as a whole paper. And part of the paper is telling how it associates with the RAM care plan. And then you'll put it into a 6-slide PowerPoint, and then you'll present it in class.
Okay. So you want it in the RAM format, but do you want it in the RAM?
Remember
Yes.
I said to you guys, the RAM format on that paper, it was a little simple process where you wrote so many paragraphs each. I showed it right at the beginning.
Yeah.
Okay.
I don't know if anybody on that was in my group, but we were talking about it and we weren't sure if is this supposed to be, so you told us about like each person in the group does, it was like 2 sentences or something. Does each person in the group make a sentence that goes into the paragraph, or can we all like each do one paragraph individually?
So really, each person is supposed to write a portion of the paragraph.
Of each paragraph, because it's a few paragraphs, right?
Let me see if I can find the instructions that I sent you guys.
I thought it was each person in the group writes a paragraph for the introduction and the conclusion.
No, let me find it.
I wasn't sure. I had wrote it down, but I wasn't sure. Hold on.
I know. I wrote it down. I hope it's in this book. I don't even.
Okay, so I had wrote down each member at page 1
I'm
of
looking
the,
for the instructions. We gotta go by those instructions, guys.
That's not even it.
Which I think was, here it is. I got it. I'm gonna open it up in 1 second.
so I had wrote down whenever I went over it that day, I just wrote down that each person writes 2 sentences each. And we were just questioning that because then paragraphs are gonna be like 10 sentences long, 12 sentences long, however long each person writes 2 sentences for each. But I could be wrong. That's what I wrote down. He was going over it in class.
Now, at this time,
Everybody see my screen?
you know where we're going.
Let me open this up on the. Can you see the RAM assignment now?
Yes.
You guys see it?
I can't hear.
Whoever has the noise in the background, can you please mute?
Oh my God, can you just mute everybody, Mrs.?
Oh, I'm sorry.
I'm trying, but I gotta find that screen, and I think I gotta stop sharing to do it.
Okay. Oh my God, can you just mute everyone?
I'm trying.
Can you mute your mic?
Okay.
Okay, better? Okay, so you guys should be able to see the RAM assignment now on the screen, okay? And what you're doing is an essay. It has 3 parts: the introduction, the body, and the conclusion. This is the easiest way to do it. So all of you should have selected an article together, and you should have read the article, all right? And then what you'll do is you'll come up with an introduction, okay? So what is the illness about? You'll list who the article is, who the author of the article is, and the population that the article is about. All right, so as a group, you would write 1 sentence to address each of these things: who the author is and who the article is about. And then each member would write 1 sentence on the illness that describes it. So let's say you had ADHD for your topic. Each person would write 1 sentence about that. And then after each person writes 1 sentence, then you're going to decide which sentence you want to use for the first statement, for the last statement, and make sure that the sentences that are in that paragraph that you're writing there don't repeat themselves. All right, so you're writing 1 paragraph there. Everybody is contributing. So the paragraph will talk about who the author of the article is, who the population's about, and then you're going to describe the illness. All right, so that's your intro. Then the body of the paper, okay? So each person in the group is going to write about symptoms, the sources where this possibility, if it's ADHD, how do people get it? What causes it? What's the treatment for it? What are complications of it? How can we prevent it? Or what can we do so that it's not as bad? All right. So let's say you're doing symptoms or treatment. If there's a lot of different things there, you can have a couple people do that if you have more than 5 people in the group. So you're just going to split it up according to how many people that you have in the group. And that's the body of your paper. Now, this here says if you want to get the paper done quickly, each group member will read the entire article, okay, and choose one of the 5 parts above and write a paragraph about it. So if you want to do that, and if that's how you decided to do it, that's fine also. The main thing is that everybody's collaborating, everybody's contributing. If someone in your group is not contributing, they should not get credit. Okay, every paragraph should be between 5 and 7 sentences. And then you have a conclusion. Again, there's 5 parts to the conclusion. So again, if you have like 7 people in your group, you could have one person do the intro, one person do the conclusion, and the other 5 people can write the body of the paper. And then together you make your PowerPoint. Again, it's going to be 6 slides. So the first slide will have the group member's name and the topic. And then you'll have 6 more slides, okay, to talk about your topic. And then the final slide will be your references. It should take you about 10 to 15 minutes in class to actually present it. Questions on that?
No, that answers my question. Thank you. We were back and forth if we all had to write one sentence per paragraph, or we were kind of talking about each writing one paragraph each. So that works out. That's what my group had already talked about. Thank you.
Okay, you're welcome. All right, so we're all good with that part, right? Okay, let's go to the VSIM.
Ms. Loesch,
Yes.
I never received the scenario overview for that patient, the email. Maria,
Maria, send me an email, okay? I don't know why you're not getting it, but send me an email. And
Okay.
I'll send you everything that I sent out tonight to make sure you have it.
Thank you.
You're welcome. And I think I recorded all this. I'm pretty sure I recorded all this, so hopefully I did. And it looks like it is still recording. So my intent is to put it up on YouTube so you guys can go back and look at it, all right? Some people, not everybody was even here for it. So, okay, so let's pull up the scenario from the point. The only thing I don't record is when I review for tests. And that's because I use certain questions and stuff, and I don't want those exposed to people. Because some people might not read the book. They might just try to, you know, do the recordings, and then that really doesn't do you much justice. All right, so you guys will go into the VSIM from your Canvas module. Okay, you'll just go to wherever the date is and you'll see Edith Jacobson there. And there should be a couple spots there you can click. But when you first go in, first you have your suggested reading. So you want to read that. And you actually might want to take a picture of it or print it out, because this actually tells you exactly what you have to do when you go into the module. All right, so it's talking about Edith Jacobson. This 85-year-old female who was admitted last night after she fractured the hip. All right, it's telling you what her vital signs are, what her pain level is, that she has morphine ordered for pain. It's also telling you that they gave her morphine at 2 p.m. All right, it's telling you what her pain level was after she got the morphine. And she also has to be turned and repositioned. You have to perform a musculoskeletal assessment. You have to reinforce safety, and you have to provide patient education on fall risk. All right. You also have to assess her pain level and medicate her for pain if needed. So all this is going to be in that front part where it says suggested reading. Now, the other nice thing is if you go down here to the bottom, I'm sure you can find really a lot of nice information right in here that will work in your care plan. All these little you can click on.
Miss, we can't see your screen.
Yeah.
Oh, I'm sorry. Let me know it.
You see it now.
Okay, so you're in this part, okay? So when you go to your VSIM, it's gonna first bring you to the suggested reading. At first, you're gonna do the pre-sim quiz, okay? And the pre-sim quiz is just a few questions. I think you can do those quizzes as many times as you want. So if you get a lousy grade, you don't like it, you should be able to go back and do it again. So this is telling you everything you have to do right here in this report, okay? What the recommendation is, that's telling you what you have to do. All right, and then down here, like I said, you have these little tabs, like about positioning the patient in the bed, making sure you handle them, preventing pressure ulcers. So if you just click on these little tabs, it'll take you to a little whole information about that. And you can go on, there's pharmacology. So if you want to know about the medications, it'll tell you about them. You want to know about the osteoporosis, the hip fracture, about the range of motion, all that, it's going to tell you. How do you prevent falls? How do you, right? And then the assessment tool for older adults. So all that's down here in the bottom for you. All right, then if you go to pre-sim, again, that's just going to be this little quiz here. You have to do this part, okay? So there's like 8 pages or 8 questions, I'm sorry. It says 1 through 8, but it's really just 8 questions. And it's also stuff that's going to help you, right? So it's asking you about complications after an illness or injury in the older adult. So what's going to happen with them? And then you have a post-sim, okay? You have to do that also. That's, you're going to do after the quiz. You have to get 100% on that. So once you do it, if you don't get 100%, keep doing it until you do. Again, it's just like 5 or 6 questions there. And then guided reflection questions you have to do. And those have to be uploaded in Canvas. You'll see a place for them. All right, so to launch the VSIM, you click on the actual VSIM there. It'll say launch simulation. Now, I do tell you, when you do the VSIM, all right, when you get your score like this, take a picture of it. Because it acts stupid sometimes. So I don't want anybody to go through it and then you don't get credit for it. So when you get your score, take a picture of it. All right, in here, you're going to get the same information that you got on the other screen, okay? That background report and what you should be doing. You guys can still see Edith Jacobson?
Yes.
Okay, so normally when you go see a patient, the first thing you do is you look at their records, okay? And the healthcare records were up here blinking because it wanted me to look at it. So when you open up the screen, this is what you're going to get, okay? Can you see her picture up there? And it should say admission report. Is that what you see?
Yes.
Yes.
Okay. So again, this is just going to say the same thing, okay? Just tell you that she has a daughter named Joyce Brown. You might want to know that for your care plan. She's white, she's Christian, you already know that. And then this is just giving you her history and her background. All right. Now, when I was in clinical, we had to go to the hospital first and pull the chart and go through this entire thing. If you look at the patient log, you're not really going to see anything because you haven't done anything. And the patient log logs what you're doing as the nurse when you come in. Your diagnostics are going to tell you about any testing that she had. All right, so down here, she had hemoglobin, hematocrit, platelets, white blood cell count, red blood cell count, all that was drawn. Her potassium was drawn, her sodium, okay? And you only have to list this in your care plan if it's abnormal. And it's just here for you for information. But you would want to analyze all her stuff here and make sure there's nothing abnormal. gives you her blood type. She's pre-up, by the way, so you would need to know that prothrombin time, that APTT, that INR. You would need to know all that because she's getting ready to go for surgery in the morning. She's gonna.
We don't see your screen again.
Yeah, we only see the admission report.
See diagnostic information now?
Yeah.
Yes.
Yes.
Okay. Now you should see clinical observations.
Yes.
Yes.
Okay. So here, again, until you start doing stuff, nothing will register here. This is the medications that are ordered and the times they're supposed to be given. You already know at 2 p.m. she got morphine. And somewhere on this screen is a clock that will tell you the date and time, all right? I don't see it right now, but it's here somewhere. This tells you about the X-ray that was taken on September 22nd at 21:15. And then this is her orders. So I put some of that on the that case study I gave you. So you kind of have some of this information at your fingertips already. Just using that. And this is INOs. So, you know, she took in about 575 mLs. She put out 600. And then anything else you want to know is up there at the top. The gender, the date of admission, her height, her weight, all that good stuff. All right, so now let's go to a different screen. That you should be able to X out of once you get done using it. I don't know what my screen's doing here. Come on, get up there. Okay, so now you should see a patient in the bed. Is that what you see?
Yes.
Okay, and you should be able to hear her breathing. Can you hear her?
Yes.
Yes.
So I try to treat it like I'm going into a real hospital room. Okay, so the first thing I'm going to do is wash my hands. Okay.
I'll wash my hands.
That's all under safety measures. I'm going to.
Hi, I'm Amy. I'll be your primary nurse today.
Hi, Amy. Nice to meet you.
Identify the
Please
patient.
state your name and date of birth.
My name is Edith Jacobson. I was born on September 20th, 1936.
Everything matches.
So I know they want me to do vital signs here. They want me to do that musculoskeletal assessment. They want me to reposition the patient, and they want me to do education. So I'm going to start with the assessment.
I'm going to take your temperature.
Okay.
The temperature is 99. I'm going to check your pulse here in your arm.
Okay.
The pulse is strong, 85 per minute and regular. She is breathing at 15 breaths per minute. The chest is moving equally. I need to check your blood pressure. You will feel tightness around your arm as I inflate the cuff.
Okay.
The blood pressure is 134 over 80 millimeter mercury. This is a pulse oximeter, which monitors the oxygen level in your blood. It fits snugly around your finger, but should not hurt.
Okay.
I'm going to check your skin for any bruises, rashes, signs of dehydration, or other problems.
Okay.
There is normal elasticity of the skin. Her color is normal and she is not sweating.
So here, I'm just gonna go back to safety measures, and before I ask her about pain, I'm gonna ask her if she has allergies.
Are you allergic to anything?
No, I'm not allergic to anything.
And then I'll go back to assessment. I'm gonna ask her about pain. And the reason I do that is because every time I don't ask her about allergies, before I ask her about pain, it gigs me. So I know that, so I did that there first, okay?
Do you have any pain?
My leg hurts a bit.
Where does it hurt?
In my left leg.
Can you describe the pain?
It hurts in my left hip, and it hurts to move.
When did the pain start?
After I fell last evening.
Does anything make the pain worse?
Any movement, really.
Does anything make the pain better?
No, nothing really makes me better.
How would you rate your pain on a scale of 0 to 10?
Not too bad. It's about a 2.
Do you need something for the pain?
No, it is not that bad now.
Okay, so I know I also have to do the assessment for a neurological. Now for this one, you don't have to do the pupil test or the eye test. You're checking neurological for the strength in the extremities because of the hip fracture.
I'm going to perform a neurological examination on you.
You're gonna do the one all the way on the right.
Okay.
The patient is conscious. Muscle strength is normal in upper extremities and right leg. Left leg is not checked for strength. There is normal sensation in all limbs.
So if you reposition the patient, then you go to interventions and you pick position patient. Okay, then you got to call for the second nurse because she has to have people to turn her.
I'm going to ask the secondary nurse to come help me with repositioning you on your side.
Okay.
The secondary nurse will be here. We can go ahead when needed.
So once it says that and it lights back up, you can go ahead and position the patient. Now, if the patient has a left hip fracture, how are you going to position her?
On the right side.
Okay, so we're gonna pick.
I will now turn you on the right side. I will make sure your shoulders and hips are in a straight line so you will be more comfortable as I turn you using the draw sheet.
Okay, sounds good.
I have adjusted your shoulder so you are not lying on it.
Okay, so now we're gonna go to communication and education. So the first one is educate patient about safety and fall risk. So we're gonna hit that.
I would like to talk to you about activities, safety, and fall risk.
Okay, but I can't get up by myself right now.
When you can get up from bed due to fall risk, it's important that you use a support person and your provided walker. We will leave your call light so you can call for us when you need help with anything.
I think that's the only one on education. Well, maybe we'll teach her. I don't know if we have to do anything about the medication or positioning. It really only said about to educate her about the fall. So let's see what it gives us once we do that part. So now that you've done everything in there you're supposed to do, then you would go to patient handoff. Once you go to patient handoff and you click OK, you can't go back. So what happened is it's going to give you a score at that point. If the score isn't 75% or higher, you have to redo the scenario until you get 75% or higher. So let's see what we got here. Now, the nice thing is it will give you a little printout to tell you what you did or didn't do right. All right, so it gave us 52%. Okay, because we didn't check the patient's IV. We didn't auscultate the lungs. Okay, we didn't assess the IV. We didn't check we did check the legs for sensation, but it says we didn't. We didn't check the pedal pulses. And remember, we have to put on those anti-embolic stockings. All right, and it says we should have provided patient information about the positioning during that time. So if you go down and look at all the red stuff, right, and you print it out or make a picture of it, then you know when you go back through the scenario what you have to include again the next time. Questions? All right, no questions. That means everybody's good. But don't forget you're on mute in case you're asking me something. Okay, if nobody has questions, that's pretty much it. That's the RAM care plan, the RAM paper, and how to do your VSIMs.
Okay.
Miss Loach, when is all of this due? Week,
So you should be getting your rough draft care plan in and sending that to me so I can check it, because I think it's due at the end of week 7 or the end of week 8.
Okay.
The RAM project you should be presenting on week 10.
Okay.
And Miss O you might want to ask her in class when you're going to do your presentations, because it should be like week 10 and 11 or week 9 and 10. I think I sent it to you in an email, actually, with everything, when it's due and when you would do the presentations. Let me stop the recording here and I'll look and see.
I had made a note that the RAM project was due October 5th and the VSIM is due October 9th, but I could be wrong. This is little notes that I had wrote when we were in class.
Okay.